right. Welcome, everyone. Thank you for joining us today. I have the great pleasure to introduce Julie Squires today, who will be speaking to you. Julie Squires is a certified compassion fatigue specialist and a certified life coach. Julie is the founder and principal of Rekindle, LLC. Julie brings a unique perspective and approach to support the sustained energy and passion of those that work with and for animals in the emotionally challenging fields of veterinary medicine, animal welfare, lab animal research, animal advocacy, and conservation and environmentalism. Julie has over 25 years of experience within leading organizations such as Bayer, IDEX, and Nestle Purina, developing and executing training, workshops, and one-on-one coaching. She is a graduate of SUNY Oswego and a certified compassion fatigue specialist through the Traumatology Institute. Please welcome Julie Squires.
Thank you. It's wonderful to be here with all of you, and especially talking about compassion fatigue as it relates to pet owners, because that is not normally what I talk about, but yet we really have to talk about it because I'm a pet owner. And I will give you a little insight into my own experience with compassion fatigue as a pet owner. But it becomes really important that we learn. This is what happens when you work with animals, is that sometimes so we also have to learn about what it means to maintain our own well-being as we are caring for them. Because here's what I know for sure. What I know for sure is that the better able we are as it relates to taking care of ourselves, the better able we are to take care of them. So you heard a lot about some of the things that I've done that bring me to this place. But one of the things that, excuse Ernie, we'll get to you in a second. But as it relates to compassion fatigue and as it relates to this work that I do with people who work with and for animals, I didn't anticipate that I would engage in it in a way that is fostering well-being. And why that becomes so important is because in my history in veterinary medicine, I've worked in that field for 25 years. I've seen what happens when we don't know what to do for ourselves. And whether or not you're familiar with this, the veterinary field has very high rates of suicide. That is essentially what got me to this place that I'm in. I also do spend a fair amount of time in the animal welfare field. And actually, when we're not in a pandemic, I'm actually a humane educator at a farm animal sanctuary, but because of the pandemic, I'm not there now. These are some of my friends at the farm animal sanctuary. So, you know, I love all animals. I was born loving animals, but one thing that I don't love is snakes, and I've tried really hard to embrace snakes, and it just is not happening for me. And just a little fun fact, what I really wanted to do in the world was actually be a marine biologist. So I'm not doing anything like that, but it's perfectly fine. So you're hearing in the background, we will do a little introducing to Ernie. He is the one who's making all the noise here for some reason. We do webinars all week long, but today he's decided he has something to say. And that is Mabel, the 4-year-old. So I have a geriatric, right? So geriatric or senior pet. And then I also have a young pet. And I don't just have dogs. I also have cats. Those are the brothers, Greg and Dwayne. And my oldest pet is Magellan. We think he's somewhere around 20 years old. He's a Russian tortoise. We don't know exactly how old, but we're guesstimating somewhere around 20. I've had him for 20 years, so I know that much about him. So I want to thank you, send a big shout out to Assisi for giving me the opportunity to speak with you all about a topic that, again, is near and dear to me. And I reached out, to say, hey, have you ever considered talking about compassion fatigue as it relates to pet owners? Because again, that is not something that is typically addressed. We talk about compassion fatigue as it relates to anyone in a helping profession. And I'll do a little defining of terms for you. So the character making all the noise in the background, This is Ernie. So Ernie has a disease called pug myelopathy, and it causes him to essentially have paralysis in his back end. So he, again, does not have any use or function of the back half of his body, which requires that, for him to be able to walk outside, he has to use a little wheelchair. That was, and I'll tell you, he got diagnosed, I guess it was about 4 or 5 years ago. I was thinking about this before the webinar, and that was my first introduction to the Assisi loop, as a matter of fact. And so he has to have his bladder expressed. He cannot urinate on his own. So yeah, you can imagine that having a special needs pet like this could create lots of emotion. And what I know for sure is that if you have a pet that's sick, if you have a pet that's senior, if you have a pet that has any special needs, there's lots of emotion that can come about. You might feel stressed. You might not know if you're doing the right thing. It's a lot of care sometimes. And again, we have busy lives. Oh, and we're in the middle of a pandemic. So there's that too. You might feel overwhelmed with the care, especially if it's just you, or if you work, or if you live with people who maybe aren't as willing or able to want to help in some of the care that's required. So you, again, could feel a sense of overwhelm. Or also, like I said earlier, we're in the midst of a pandemic, so everything, I feel like, is more overwhelming. You might feel guilty. You might feel guilty if you have to, or you're wanting to live your life, but yet you have a pet that's requiring, daily or twice daily insulin shots. Or in my case, I have to be here to make sure I can't just have somebody else come and take my dog out to go to the bathroom. I have to be the one to do it, or my husband. So you might feel guilty if you want to go to something that takes, 8 hours and you're not going to be home for that period of time. You might feel inadequate with all of the things that are required in dealing with pets that have special needs or that just have special concerns. Again, I'm guessing the vast majority of us on the webinar don't have a DVM. You might feel resentful sometimes. And, I want to give you some space that it's okay to feel resentful sometimes. It means you're normal. It means you're normal that if you want to go on a trip, let's say before the pandemic, that requires that you fly somewhere, and you decide to not do it because you're afraid, you don't want to leave your pet with somebody, or you're afraid they might die when you're not home. And then sometimes you can feel like this sense of resentment, like, oh, like I really want to go to Hawaii, but there's no way I can do that. And again, I want to give you permission that it's okay sometimes to feel a little resentful. And yeah, sometimes you might feel sad, because it is sad to see any being, animal or human, get older and start to fail and start to dance with, with knowing that death is around the corner at some point. So what is compassion fatigue? Compassion fatigue, the way that I describe it, is it's a combination of physical, emotional, psychological, and even spiritual exhaustion or depletion that exists when we are continually or bearing witness to others' pain and suffering. And pain and suffering, again, to some degree is in the eye of the beholder, right? What's pain and suffering to one may not be to another. But when you are constantly, seeing your pet, for instance, and they're, if they're having cognitive issues and they're in the corner of the wall, in the corner of the room and they're barking, if they're struggling to walk, or if they're not eating or if they're in physical pain because of a surgery or something like that. When you're continually exposed to that over time, that does have an impact on you for sure. And we call it compassion fatigue. It's not a mental illness. It's just a set of signs and symptoms. So what are the signs and symptoms? Well, they're varied and they look different in everybody. There's no check the boxes and then you'll know. But they might be things like feeling depressed, feeling hopeless, physical and emotional exhaustion. You might sense a diminished sense of enjoyment from the caretaking. You might have some bottled up emotions or feel irritable, or you might be starting to drink more or overeating. You might have sleep problems or feel anxiety or problems in your personal relationships. And that can happen, especially when we have pets that maybe everybody in the household isn't in alignment with what they think their care should be. You might feel isolated. You might have physical ailments, digestive problems. You might have some intrusive thoughts or nightmares about what's going on with your pet. And again, the extreme on the trajectory, of course, is suicide. So I want to also differentiate burnout from compassion fatigue. Burnout is an issue that has no trauma component to it. Burnout really is the dynamic that's set up when we're being asked to do too much with too little resources. So it could be, maybe, who knows, maybe some of you have a lot of animals and they all are senior or have special needs, and you have just too many responsibilities and there's just one of you. So that could set up the dynamic for burnout. In other words, there's too much that's being asked and not enough to meet that demand. And that could be not enough finances, that could be not enough man or woman power, that could be not enough capabilities or skills. And you can, of course, be burned out and have compassion fatigue, both. Yes, and I see that a lot with a lot of the populations of the people that I work with. So I want to give you what I designed for the rest of the time together is I have 10 mindset, perspective shifts, concepts for you to consider that I think will be super helpful for you. So, and again, there's 10 of them. So I'm going to start with the first one. Choice versus have to. Like, what am I talking about here? I want you to always remember that we are choosing to care for them, that it's a conscious choice. When you start believing that you have to, it feels like a burden and it can make you feel trapped. And I never want to feel that way. So I'm always reminding myself that I'm choosing this and that any time that I want to choose differently, that'll be okay too. But I always want to be caring for my pets from this place of love and joy and feeling compassion, and not from a feeling of obligation. Obligation feels very suffocating and trapping to me. And that's not the way that I ever want to approach caring for my animals. Number 2. Be here now. So unless you have a tortoise, which I actually do, or an elephant, chances are really good that you're going to outlive your pets, right? I mean, we're going to experience their death, right? Our pets generally don't live that long, at least in comparison to us. And I want you to not miss out on a moment of their life by thinking about their death. Their death will come when it comes, and it will come at exactly the right time. So this image that I'm showing you here is of my my past dog, Virgil, and he was my first dog I ever had. And again, he was super special to me. He lived until he was 17 years old, and he got diagnosed with mast cell tumors at the end of his life. We're around the age of 16 3/4, I suppose it was. And I remember that there was this one day that, again, we had tried some chemotherapy and, that wasn't really working. And I knew the end was near. And again, he was still eating and that was his favorite thing in the world. So one particular day I'm sitting out on my front porch and it was a beautiful day. And I thought, oh, let me pick up Virgil and let me swing. I have this beautiful chair on my porch. It's called an air chair and I highly recommend them. You should have one. And essentially, it's like a swing for adults. And it's made of canvas, and it has these wooden, posts in it that hold it all together. And it's super relaxing. So I thought, oh, I'll get up in the air chair with Virgil, and I'll scroll on Facebook or scroll on my phone. And the moment I thought that, there was this little voice inside me that said, no, leave the phone, drop the phone. Don't go to the phone. And the little voice was sort of be here now. And what be here now means is be in the moment. Don't miss the moment. They're not here for very long. Don't miss their life by being on our phone, and that was sort of the message to me. So I sat in that chair that day and I just sat there with him and I cuddled him and I looked at his face and I sort of I remember taking a snapshot of his face because again, I knew the end was near, but I'm so grateful that I didn't miss out on that moment of being here now. And I think that's really important. Number 3. Oh, this is me and Ernie. This is the one who was making all the noise before. We apologize. So my number 3 tip is about not arguing with reality. I've learned to not do that. One of my spiritual teachers, Byron Katie, taught me that when we argue with reality, we lose, but only 100% of the time. So as pet owners, it's really tempting to think that our pets shouldn't get kidney disease, or that they don't deserve cancer, or that the surgery that they had should have cured them. It's tempting to want to blame others, like veterinarians, like family members, or even ourselves about things. And we want to blame ourselves, in such ways like, oh, I should have gotten the biopsy. If only I brought them to the vet sooner. If only the vet caught it earlier. But you see, none of these things changes the outcome or the past. You can't go back and change the past. I believe that everything that happens exactly as it's supposed to. And arguing with reality does only one thing. And the thing that it does is it creates suffering. And suffering is optional for you. I want you to know that. So Virgil, the dog I was showing you in the last slide, we missed his diagnosis. I brought him to the vet. He had this thing on his like neck, and I brought him to the vet, and we did a needle aspirate, which a needle aspirate is taking some cells, looking them under the microscope, and my vet did not see any cancer cells. So for the next, 3 or 4 months, we're treating this thing on his neck as a skin problem. And we're doing all of these things that essentially were helping to grow the cancer, but we didn't know it was cancer. Now, it's very tempting to, number one, want to blame my veterinarian, to want to be mad at the universe, to want to wish things were different. I spent no time doing that. Zilch. You know why? Because I know that, first of all, we can't turn back the hands of time and change things. Number one. Number two is I don't want to waste a moment of my precious life and my dog's precious life by wishing things turned out differently. I can't change the past. So I want you to really hear me when I talk about this, about not arguing with reality, because we can do this a lot. And again, it will cause you to suffer. And pain is not optional in this life, but suffering for sure is. All right, let's talk about self-care. Holy mackerel. As dedicated pet owners, I know that it's easy to get consumed with our pets, but trust me when I tell you that they don't want that for us, nor does it allow us to rejuvenate ourselves so we can take great care of them. You must take time to replenish your mind, your body, and your spirit. It's not optional. It's not negotiable. You have to do it. And you also have to find ways that don't mean more animals, which I know is weird. But sometimes for those of us that are animal lovers and we're pet owners, sometimes like all of our hobbies have to do with animals. And I get it because animals are amazing and super cool, but what ends up happening is you create for yourself more of the same. You have to find things that take you away from animals for a bit. Hiking, walking, painting, reading, gardening, meditating, yoga, things like that. Fill yourself up so much so that you can give to your pet from your overflow. It can be really draining when they're fighting an illness. And, again, if they're senior pets and they're starting to have some of those cognitive issues that I talked about a little bit before, so you have to make time for yourself. And I'm not talking about just like once a week. I'm talking about every single day. Create some space just for you. I don't care if it's 10 minutes. 10 minutes matters. All right, number 5, let's talk about having gratitude. So we're all human beings here. And here's what I know about your human brain, because it's the same as my human brain. We all have a negativity bias. So our human brain, its default setting is to look for and find things that are wrong. Like that's what it does. It finds things that you've done wrong. It finds things that others have done wrong. It finds things that's wrong in the world, which, oh my goodness, not really helpful for a time right now, like during a pandemic, right? So you have to be really deliberate to look for things that you're grateful for, that you're appreciative of. And I'm so grateful every day that I have with my pets. Like I worked in veterinary medicine in a veterinary practice for 5 years as a veterinary technician. And then I managed a practice and many other years in other aspects of vet med. But I'll tell you one thing that I learned working in a veterinary practice, and that is to not take a moment for granted. I know that I wasn't promised anything with my pets. I wasn't promised that they'll live to be 15. None of us are. I know that young animals die, and young animals die all the time. So I make it a point to find gratitude and the blessings in every single day. Every morning when I wake up, and again, big surprise, but my dogs sleep with me. every morning when I wake up and I look over, and if their faces look back at me, I have a moment of gratitude because I'm appreciative that, oh my gosh, I get one more day with them. Number 6. Oh, let's talk about being compassionate with yourself. The number one, hear me loud and clear when I say this, the number one contributor to compassion fatigue is how we talk to ourselves, how we treat ourselves. And we can be brutal on ourselves in what we say and how we treat ourselves, and this will chip away at your joy. The reason we love our pets is they provide us something that human beings don't do very well, and that is unconditional love, right? They love us no matter what. They love us when we screw up. They love us when we're amazing. Our human counterparts aren't so great at this. We're not so great at loving each other unconditionally, which is why our pets mean so much to us. But you also have to love yourself unconditionally. You have to love yourself when you screw it up. You have to love yourself when you do it wrong. You have to decide to believe that you're always doing the best you can with your pet. And yes, sometimes you're going to find out that what you did was wrong. There's no question about it. Or sometimes you're going to find out that you should have seen something that you didn't, or that you should have, acted on it sooner than you did. But I want you to decide right now, in this moment, that in the moment, you're always doing the best you can. And hindsight is 20/20, but we don't get the privilege of hindsight in the moment. Hindsight comes later. So join me in deciding that right now, you're doing the best you can for your pet. And again, believe that. Remind yourself of that always. Number 7, believe you've already done enough. What do I mean by that? You're probably wondering. Well, all right. So if you're on this webinar, I already know something about you. I already know that you care deeply for your pet. I know that you'll do whatever you can physically, emotionally, financially to give them the best life you can. I also know that you'll likely go above and beyond most pet owners you know. But I think it's really important to acknowledge that you've already done enough. Because when you believe you've done enough, then what you do comes from this place of abundance. You do it because you love doing it. And that's the way I feel about Ernie back here, wherever he is now. He's finally calmed down. I know that I have gone above and beyond what most human beings would do for him. So therefore, again, and I say that not to shame other people. Again, we all have different capabilities, skills, desires of what we want to do for pets. And I'm all for all of it. I don't begrudge anybody who, would put down a dog because they developed a disease like this. Again, it's not for everybody. And we all have to decide for ourselves. But since I know that I've already done enough for him, I can now care for him from a place of just pure love. Give yourself that gift. Give yourself just the knowing that, again, you've already done enough. Because when you believe you've done enough, what you're offering them is just sort of like bonus all of the time. And it comes from such a beautiful, pure place versus this place of, again, like I talked about early on in the webinar about, coming from a place of obligation or coming from resentment or coming from a place of feeling guilty all the time. That just doesn't feel good for you. And I'm going to tell you, it doesn't feel good for your pets to be on the receiving end of that either. Number 8 is about trusting yourself. Trust yourself that you know your pet best, even versus the veterinarian. Trust your intuition. If you think there's something wrong, keep looking, even if it does mean going to a different veterinarian. But remember, the veterinarians are some of the most amazing people you'll ever meet. They want the best for your pet. You must listen to their opinion. And while they are the expert, you're the expert on your own pet. You can be respectful and have an honest conversation with your veterinarian. And hey, they may tell you that they think your pet is suffering. Take their opinion into consideration, but ultimately you know your pet the best. And yes, you have to trust yourself to know when it's time. And my criteria for that is a few things. I sort of look at my pets and I look and I'm like, do I still see joy in their eyes? Do they still seem to enjoy those few things that I know mean the world to them? And again, I have pugs, so food is always right there up on the list. But maybe it's their companion if you have other pets. Do they still, enjoy those other companions? Do they still enjoy their bed? Do they still enjoy being snuggled or pet? And well, there's a question there, like, did they ever enjoy being snuggled or pet? Because some of them never did. That's okay. But I always keep asking myself also the question of, hey, you know what? Like, am I keeping them here for me or for them? And that sometimes can be a hard question to ask ourselves, and one that the answer we may not like, but it's one to ask ourselves for sure. Number 9, find a great veterinary support system. So I spoke a little bit about, veterinarians and all of that. And here's why this is important. Because again, if you have a senior pet, if you have a special needs pet, or if you have a sick pet, you need a veterinary support system. You need a veterinarian and a veterinary staff that you can trust and that you can work with. And you're not going to have to look far to find a wonderful veterinarian or a wonderful veterinary staff, but find a practice that you feel that you connect with. And like I said, they want the same things you do. And it's great to educate yourself, but I want you to remember, just like WebMD doesn't make us doctors, neither do Facebook groups or Google make us veterinarians. So again, be respectful, but find a veterinary team that you really feel like gets you and again, understands you. Even if we don't agree all the time, it's okay. We don't have to agree all of the time. All right, let's bring this home. Number 10, don't forget to just love on them. What do I mean? When you have geriatric pets or pets with lots of health issues or special needs, we have to be careful that every interaction with them isn't to do something, like to pill them, or like in Ernie's case, to express his bladder or to put ointment on an incision. Make sure to give equal time to just loving and cuddling them. We don't want our pets to cringe when we're around them, right? We want them to benefit from just us wanting to be near them. And you benefit from it too, because it doesn't feel good for you when all of your interactions are, on a medical basis, or you're having to do something for them. And after all, hey, it's a privilege to have them. They found the exact right pet owner in you. Do what you can for them out of love, and you can never, ever, ever go wrong. Be kind and gentle with yourself, and know when to ask for help. And know when to give yourself permission to say, you know what, I've done enough, or I've done all I can. One thing I know for sure is that our pets would never want to impose on us or burden us. If it feels like a burden, you're doing it wrong. And I don't mean to say that you are wrong. What I mean is that the intention that you're bringing to caring for them is misguided. So with that, some days are going to be really hard. And when it's steeped from this place of love, you're going to have equal days that feel wonderful. You're going to feel those days that feel light, that feel good. And please know that you're someone special, and accept the love and appreciation that your pets are showing you every day, because if you're paying attention, they are. Sometimes it's in purrs, sometimes it's in head rubs, sometimes it's in licks on your hand. But make sure you see that. Make sure you accept that. And thank you for being such an amazing bright light in your pet's world. I know they see you. I know they care about you. I know they love you. And I know that they really appreciate you. So again, accept it. So with that, that's who I am and all of my stuff and where you can find me. And I know that Assisi has some really good specials for you. I want to bring that up and see if there's any questions that any of you might have.